Hi there, I am Samantha Hughes, the Clinical Education Coordinator at the University of Idaho's Masters of Science and Athletic Training program. Thank you all so much for taking the time to complete our preceptor training today. This session should be pretty quick and painless. We're going to go over a couple pieces of information, but we've really distilled it down to the most critical points we need you to know to be successful in mentoring our students. So let's go ahead and get started. We'll go through some program updates, basic program information and standards, some of the CATIE standards regarding supervision, and approaches to student mentorship. Then we'll have a short training on our eValue system, which we'll use to track various clinical metrics like our hours, evaluations, and competencies for our students. So here's a look at our current faculty for our MSAT program. We have Dr. Jamie Baker serving as our current program director. Again, I am serving as the CEC. And then we have Sydney Leverett, who is another key MSAT core faculty member. Now, we do have a few other faculty members serving in our MSAT and DAT programs, as well as many adjunct faculty members, postdoctoral fellows, and then teaching assistants. Firstly, it helps to know what our program aims to accomplish with our students so that you can align with us in this goal. Our mission is to redefine excellence in patient care by preparing students with the skills necessary to embark on a path towards advanced clinical practice. We strive to have our students purposefully integrate clinical practice, research, and education to provide excellent patient care and solve relevant problems in the clinic. As a preceptor, you play a crucial role in achieving this mission. Anything our students learn from you, they will put into practice. We want to ensure that our students have a great clinical experience. If you've spoken with me or another representative of our program, you might already know about the delivery methods of our program and how we format our clinical immersions throughout the entire fall and spring semesters. This structure really helps us achieve this mission and vision. While we spend significant time with our students in the classroom, they spend even more time with you in patient care and clinical settings. So your contribution is critical to the foundational knowledge of athletic training and our students' future professional practice. You set that foundation for their learning and experiences, and we are here to support you any way we can, providing resources and assistance as needed. So please feel free to reach out to us anytime you need anything. We want all of our preceptors to understand our commitment to supporting you and your efforts in mentoring our students effectively. Before we start diving in, here's a quick little glimpse of our site map showing our current site affiliations throughout the countries. Our students are gaining diverse clinical experiences nationwide, but if you have resources, colleagues, or connections who might be interested in collaborating with us, please feel free to share our information. We are always looking for new experiences for our students. One thing we feel would help our preceptors prepare is understanding our program's course sequence. So here's a brief overview of what our students are learning at various stages in the program. To start, our summer semester session is held in person, and our students do not have any clinical requirements during this time. This period serves as our intensive, basically athletic training summer camp, where our students are in class all day for 9 weeks, and honestly, this includes most weekends. During this time, we focus heavily on lab-based teaching, ensuring students gain essential skills to step into their clinical settings in the fall semester. This approach allows them to build momentum so that when fall semester comes around, they are better prepared to integrate classroom learning into their clinical experiences. So in year one, the summer semester, students take their lower extremity clinical anatomy course, which includes both a cadaver prosection lab and a functional lab. This course allows them to see inside the body and assess those structures clinically. Concurrently, they're also taking an evaluation course for the lower extremity, learning about the different segments of the body sequentially to match their coursework across the other subjects. They also take courses in care and prevention of injury and illness, emergency management, Introduction to Rehabilitation, and their first modalities course. Then they transition to the fall semester, which introduces that hybrid education with in-person meetings mainly happening during the final exam week. Courses during this semester include their clinical education and experience courses, research methods, prevention and health promotions, and the psychology of injury and referral. This hybrid model allows our students to engage more in readings and discussion-heavy content without a ton of new hands-on skills. During the spring, again, we continue that hybrid model with courses like Gen Med, Neuroscience and Athletic Training, Ethics and Admin, and then ongoing their clinical site work with their preceptors. From there, students transition into their second year, coming back to Moscow for their summer semester, where they begin to take a second anatomy course and focused on the upper extremity. Again, with that applied anatomy and eval courses aligned. They take an advanced applied rehab course, exploring techniques like dynamic neuromuscular stabilization, McKenzie mechanical diagnosis, the Mulligan concept, primal reflex release, and then some other central nervous system regulation techniques. This course aims to develop their clinical reasoning, moving from assessment and diagnosis to treatment and outcome evaluation. Additionally, they have a seminar course and their second therapeutic modalities course focused on electrical modalities. Just like their first year, in their second year, they move to hybrid for fall and spring, where they're taking classes online and then completing their clinical rotations. In their fall, their courses include a second research methods and statistics class, critical issues in athletic training, another Gen Med pharmacology class, and then ongoing clinical site work. Their final semester is more streamlined, with the students taking a BOC prep course and finishing up with a scientific inquiry and presentation course. This course synthesizes their research and statistics knowledge into a critically appraised topic paper, which they then present to their class, cohorts, or at the national, regional, or state conferences. In the summer, we also offer certification level courses in various manual therapy techniques taught by experts affiliated with those institutes. Actually, often we have open spots for our preceptors with a very minimal cost compared to the original cost of those courses. And again, this is going to provide exposure to those same techniques that our students are learning. So keep an eye out in the spring for information on available courses. Typically, these are held in Moscow on campus of the University of Idaho. Although space and budget limitations can sometimes restrict availability, we do strive to include as many preceptors as we can. So again, this is an overview of our program's course sequence, and it's going to give you a clear picture of what our students are learning at any given time. By knowing whether your student is a first year or a second year and their current semester, you can understand what they've already accomplished and what they've been exposed to, and then where they're headed in the future. This knowledge helps you gauge their skill level and what kind of information that they've received so far. Now let's discuss the CATIE supervision policy. Previously, preceptors were required to be in auditory and visual contact with their students at all times, meaning that they needed to be able to speak to and see their student to intervene on behalf of the patient. The new standard for supervision still requires preceptors to be on site and able to intervene, but also emphasizes the developmental continuum that allows students to move from interdependence to independence based on their knowledge and skills and the context of care. Supervision must comply with the state practice acts of the state in which the student is engaging. This new approach supports a logistical progression, allowing for increased clinically supervised responsibility, ultimately leading to autonomous practice upon graduation of the student. We want you to feel comfortable giving your students autonomy appropriate to their skill level and your clinical setting. This dynamic allows you to challenge them and continuously reevaluate their skills as they learn alongside you. Now, with that expectation, our students do have their own expectations. Our students are trained to seek feedback from you, not act without your approval on any patient case, and then review patient cases with you regularly. From a preceptor's perspective, it's crucial to get to know your student and their skill level, challenge them appropriately, and gradually give them more responsibility. This approach ensures a safe and effective learning environment where students develop their proficiency and professional behaviors required of an athletic trainer. Some other student expectations are that they are required to wear their name tags that clearly identify them as athletic training students. This helps prevent them from being mistaken for a professional athletic trainer, ensuring a safe learning space. Students are also expected to practice professionally around each and every patient, maintaining a degree of separation and creating professional boundaries. Our dress code requires students to be neatly groomed and professional at all times, wearing solid colored polos, t-shirts with a UI or your institution logo with khaki, blue, black shorts or pants. Now, we do allow hats if you are outdoors at a practice, but at no times should jeans, jean shorts, sweatpants be worn. Now, if your site requires an attire that goes beyond our program's minimal standards, the student must follow your own dress code. Our behavioral standards align with the NATA and the KD professional standards, as well as those of our university. We expect a high level of professionalism from our students, and we appreciate any feedback you can provide on this. If you notice any infractions, please bring them to our attention immediately so that we can address those promptly. Travel is not a requirement for our clinical rotations, but if a student is given this opportunity, they are expected to take advantage of this and represent the program and your institution in the highest manner. Students may only document the hours of direct patient care during travel, and they may not document the hours of travel itself. In the presence of patients while traveling, students must be supervised by their preceptor. And this means that students may not travel on a bus or a car alone with patients. The preceptor must be able to intervene if necessary. Students must complete a minimum number of hours dependent on the semester they are completing. Just like their autonomy grows on a continual level, so do their hours. These set hours do equate to about 20 to 25 hours per week at their clinical site, but we know this may vary depending on the sport assignment or travel that's happening week to week. Now, if a student is gaining a significant amount of hours, our faculty will be checking in with the student and the preceptor to make sure the student is having enough time to complete other programmatic things and just making sure they have enough time for themselves. Now, we do have a maximum amount of hours for each semester, but if a student is coming close to that maximum, they will need to get approval by the program before they continue at the site. Though this is an immersive rotation, our students are still completing a full course load of work while they're at your clinical site. This coursework is fairly flexible, so we do encourage you to determine the best schedule for your student, ensuring they are meeting their educational goals while fitting into your clinical setting effectively. We rely on you to determine the student's schedules for several reasons. One, you know your clinical site, the schedule, teams, and work environment best. You can identify the optimal times for the student to gain exposure to patient care and the role of an athletic trainer. We want students to be actively engaged during their time with you. If there, for some reason, are periods of downtime, it's perfectly acceptable to schedule the student for 2 shifts, like a morning and afternoon shift, to ensure that they're consistently participating and not having a lot of idle time. By setting their schedules, students will know their hours ahead of time, allowing them to plan their academic work and personalize effectively. Our only fixed class times are Monday for the first year students and Tuesday for the second year students from 9 a.m. to 11:45 Pacific Standard Time. These times are mandatory and students should not be in the clinic during these periods. Any other time outside of these hours is available for clinical practice. We also require the students have at least one day off every 7 days, providing them with 24 consecutive hours of rest. Some clinical sites may choose to give the students additional days off, and this flexibility is crucial as each student's needs are different. Regularly adjusting the schedule to meet the students' needs, particularly after the initial weeks of training, is important for their success. Our official start dates for the semester are around mid-August for the fall and early January for the spring. Now, students can start earlier, but this early start is considered volunteer work, and this does not count towards their clinical hours or course credits. Students know they must be oriented with their site and discuss the goals and expectations with their preceptors well in advance of the first day of the semester. Students are also aware that the University of Idaho holiday breaks do not apply to their clinical rotations. The student will follow the schedule set by their preceptor in regard to breaks like Thanksgiving or spring break. Though they may have a break academically, students know that these breaks may not translate over to their clinical rotations. Lastly, students will return to Moscow in order to complete their final practicals in early December for fall and then early May for spring. Now, our program strongly discourages students from working jobs while they're enrolled due to the demanding nature of their studies. We do have very few students who attempt to work while in the program, and they manage it successfully and balance their responsibilities, but they do know that their academic and clinical needs come first. If for some reason a student does need to miss clinical time for a valid reason, whether that's a wedding, additional course, family emergency, they must submit an absence request form at least 2 weeks in advance if possible. This ensures accountability and clear communication with you and the program. Of course, we understand that some emergencies cannot be planned in advance, but this absence request form, again, provides that clear communication. When first arriving to your site, the student will need to collect and submit the following documents as part of an assignment. For each venue the student will be working at, they will need to submit a venue-specific EAP, your institution's HIPAA or FERPA policy, as well as your bloodborne pathogen policy. If your site has modalities, students will need to submit the calibration records for each modality to show that it has been recalibrated and safety checked. This can be in the form of calibration stickers or the calibration report. If there are outdated or missing calibrations, the student may not use that modality and must submit a notice signed by the student and the preceptor. So let's talk a little bit about the forms that you'll be completing while your student is out at your site. Firstly, after completing this training, you will be sent a preceptor agreement form via eValue to sign, stating that you reviewed and understand the training. At the start of each rotation, you will have a meeting with your student to discuss the goals the student has and then the expectations you have for the student. This helps set the stage for a successful clinical experience. Formal evaluations of the student will be held at the midpoint and end point of each semester. You will go through eValue and rate the student on a Likert scale of 0 to 9 on various sections. And then we ask that you sit down and have a meeting with the student to discuss their progression and adjust goals as necessary. Lastly, we have a clinical experience checklist, which you will get at the end of each rotation, basically asking all the different experiences the student was able to see, whether that's patient populations or different healthcare practitioners that the student was able to work with. Now, throughout the semester, we will have ongoing communication and feedback. Our faculty conducts monthly check-ins with each student and preceptor to monitor the student's progress, discuss any conflicts, and ensure that they're receiving the best possible experience. These check-ins help facilitate communication and address any issues early on. We ask that you provide consistent and constructive feedback to us and the students to help the students understand their progression and then areas of improvement. If a student is excelling or if for some reason there is an infraction, please let us know. We value your input and document both praise and areas of needing improvement. Again, if we aren't hearing it from the student or from you, we most likely won't know what's going on. But if you have any questions or concerns, please feel free to reach out to us as soon as possible. We are here to support you and ensure a successful learning experience for everyone involved. Now let's move into our eValue training. So when you log into eValue, you will be given a link to change or update your username and password, and then it'll take you to your homepage. On your homepage, you will see we have all these different tabs up here. This home tab will be your main button that you're going to click. Under the home page, you'll see a couple different areas on the right side. These are going to be all the resources for you as the preceptor. We have all of our trainings here. We have our rubrics for our competencies here on the right side, our handbook, the absence request form, basically anything you will need as the preceptor. Here in the middle, this urgent task, anything that you need to complete will show up under this urgent task box. You should also receive email notifications when there is something for you to complete. So the first thing, your preceptor agreement form will pop up under here as a complete pending evaluation, and it'll show you how many you need to complete. You will then click on this link and it'll take you directly to that evaluation to read over and sign. Other things that will pop up here will be your students' time entries. Once they submit times, they will be logged to you and then pop up here when they need to be signed off. Same with our competencies, which will be named case logs in eValue. Here's another look at some of those resources here. Again, the trainings, how to fill out the preceptor form, how to fill out an evaluation, and then here are some of our rubrics for our competencies, which we'll talk about soon. Our competencies are psychomotor skill-based achievements that the student will need to check off during their time at your site. Each semester will have a set number of competencies that they will need to complete prior to the completion of their rotation with you. You can see those here. And again, they will be listed on those rubrics at the bottom on the right side of that homepage. When a student submits a competency to be signed off, they have completed that competency with you, you've evaluated them through the rubric, they will submit that through eValue. That will pop up on your homepage under urgent task under the sign off on case logs. You will then click that link, which will take you to this filter page. On the filter page, you do not have to fill out anything else on here. You will actually just scroll to the bottom and click next, which will take you to the competency list that the student has logged to you. You will either confirm the competency that the student performed the skill at a 70% or better, or you will reject the competency if the student was not proficient in the skill. From there, you will click Save, and those competencies will either be signed off and confirmed or rejected. Now, if for some reason a competency is rejected because the student was not proficient, the student must complete that competency again with you. If for some reason there's multiple preceptors at that clinical site, the student cannot run to the next preceptor and try to sign off that same competency. they must come back to the original preceptor who rejected the competency to go over it again and make sure that they are proficient in that competency. Again, students will have a complete list of competencies that they have to complete each semester, and these are counted as a grade in their clinical education course. We ask the students and we tell the students to not wait until the last minute to complete all those competencies. If for some reason you have a student that comes in the last day and tells you they have 30 competencies they need to check off before they're done for the day, you are allowed to say, absolutely not. You should have spaced these out throughout the semester. You don't have time during the day to knock out all of those 30 competencies. We tell our students they need to be working with you and communicating with you as the preceptor to make a schedule to complete all of these throughout the entire semester. Next, we have patient encounters. So these are designed to provide the student the opportunity to gain experience with a variety of different health conditions and patient populations. These can be interactions with real patients or simulations done with you. Now, our students must track each patient encounter during their time at their clinical rotation. And we ask that they're completing at least 150 encounters each semester. This is the list of the encounters that the student must complete at some point during their time in the program. They don't have to see all of these different patient cases at one clinical rotation. Now, don't get scared with this big number, 150. The students are not actually logging these to you as the preceptor. They will actually log them to us as the faculty so that we're not bombarding you with 150 plus things to sign off for the student while they're at your site. But knowing that they will be logging patient encounters in eValue and keeping track of those while they're out at your clinical site. Other things that you're going to sign off on are their hours. Again, students will log these and then it will be generated to you under your homepage urgent task. You will click this link, sign off on student time entries, and it'll take you to a page with a calendar that looks like this. If you have multiple students, you'll need to filter to the specific student that you're wanting to sign off on, and then filter to the specific month that they have submitted their hours to. Once you get to that month and that student, you will see the hours that they are submitting to you. A red circle means that it has not been signed off on yet. So you can then click that circle to confirm and it'll give you a green check mark, or to reject, and then it will delete the hour. There's also a place to make notes in our hours time slots if you or the student feels that's necessary. Again, as a preceptor, you will be generated evaluations. Those will pop up under urgent task. You will click that link and then you'll go ahead and fill out that evaluation. It'll ask you specific questions about how the student is performing, grading them on that Likert scale of entry-level student to second-year student or first-year student or wherever they are on that scale. Again, we ask that once you submit this, that you discuss this with your students so they know how they're progressing and then things that they can continue to work on. Once we get towards the end of the semester, signing off on these evaluations is really important because this is a large chunk of the student's grade. If for some reason a preceptor doesn't sign off on the evaluation in time, the student actually incurs an incomplete for the course until that preceptor evaluation is completed. So once this is generated to you, please fill this out as soon as you can and discuss with your student. Lastly, here are a couple different resources that you will have as a preceptor. On eValue, we'll be posting videos, trainings, articles for you as a preceptor. And again, those are not required, just things to help you as a clinician. Again, we also have many continuing education courses that we bring to the Moscow region, things like the Mulligan concept, primal reflex release technique, rock tape, myokinesthetics, total motion release. All of these may be available to our preceptors for a reduced cost. And you can use those for your CEUs as well as your preceptor time. If you would like to use your preceptor time as a CEU, please reach out to me. I am more than happy to send you a document that you can submit for those CEU credits. The last thing here are just a few things that you will need to submit as the preceptor prior to your students starting at your clinical site. You should have received a link to a preceptor survey where you will submit all of this information. The first is your BOC verification. So we'll ask for your BOC number and then a screenshot of that verification showing that you are certified and that you're staying up to date with that certification, showing the expiration date. You'll also list your license verification if applicable, along with a screenshot of your license showing that you are in good standing with your state. Per the KD, all preceptors must have an NPI number, so you'll submit that number as well as a screenshot of that verification there. And then lastly, something new for all of our preceptors is completing a contemporary expertise table. I've included an example table within your preceptor survey in that new preceptor email. But this table, you're going to put all of your contemporary expertise we ask for the last 5 years. Now, this can include your clinical practice, any additional courses you've taken for CEUs, any research that you've done or presentations that you've done within the last 5 years, if applicable. Now, if you want to put everything in here for the many years you've been practicing, you can absolutely do that. But we, again, ask for the last 5 years. If you have any questions on this contemporary expertise table, I'd be more than happy to meet with you to help you fill that out. But again, there will be an example for you to follow there. Lastly, again, we thank you for being able to serve as a preceptor for our students. We're really excited to have our student join you. And again, we are so thrilled that you're going to be able to help mentor these, hopefully, future athletic trainers.